My name is Dr. Robert Bacci. I'm a physical therapist, and I'm one of the developers of the Swingzilla program. The program's appropriate for any type of athlete that participates in a sport that has a swinging motion. What we found out in working with students and athletes is that if you have any motion that requires trunk rotation as well, it seems to have a beneficial effect on their performance, because the motion when you're doing the exercise or going through the program is a combination of swing and trunk rotation. So, we've used it with a large number of different types of athletes, including volleyball players, golfers, tennis players. We've had a tennis pro go through the program, and he's using it with his kids. Baseball, hockey, swimming, anything that has that kind of motion. The program's very simple, and it's very easy to implement in the clinic. What we usually do is we usually have a couple of athletes come at a time. It takes about a half hour or 40 minutes to train them, and we could set it up any number of different ways. One way is to train them 3 times a week for 8 weeks, which is the length of the program, the ideal length of the program. But once you've introduced the program and the athlete or the student understands it, you can really train them in fewer visits if you want. So what we've been doing is training them 3 times the first week, 2 times the next week, 1 time the next week, and then just checking them once a week. And we've gotten the same end result with it. So it's a pretty effective program as long as the person that's being taught understands the mechanics of doing it and does the mechanics, performs the mechanical part of the exercises correctly. One of the good points of this program is it's an entry point to dealing with the coaches at the high school and with the students at the high school. So I think it's really a great opportunity to start establishing some type of community outreach or a cash-based program that's not reliant on referrals. And the Swingzilla program was really designed around the idea of working with baseball players and golfers to increase their swing speed and improve their performance. And we've used it with athletes, but we've also used it in the clinic with patients with shoulder injuries as well as upper trunk injuries, because the exercise that the main exercise that comprises the program utilizes both shoulder muscles as well as torso and trunk rotation muscles. So it's become not only a standalone program, but it's become part of the treatment protocol for many of the shoulder patients that we see, especially if they're involved in sports of any kind. With the cost of the license, how it's structured, it would take 2 or 3 athletes a year. I think if you just use it for training athletes, you would recoup that in 2 to 3 athletes during the year and then be making money. By the way, it does not take a physical therapist to train an athlete in this program. It's a wellness program, so any staff member who is competent in performing the exercise and training the students or the athletes can do that. So you maximize your return by using a staff member that's not necessarily earning a physical therapist salary. If you use it as part of your treatment protocol with shoulder patients, then it's just kind of extra icing on the cake. I mean, you're already charging your patients for their treatment. It just becomes an added tool in your toolbox that you have to use with those patients. But easily 2 to 3 athletes during the year, you will recoup your entire investment and start making money. What you love,